Hi, all. Thanks so much for joining. Speaking of making healthcare work for you, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta. And today we welcome Lisa McLaughlin, who is the co-founder and co-CEO of Workit Health. Thanks so much for being here.
Great to be here. Excited to talk with you today.
Can you just start by telling us briefly what Workit Health is? And then we have a million questions to ask you.
Yeah, so Workit Health is an on-demand digital addiction care platform that delivers mobile-first, medication-first evidence-based recovery services. So ranging from intensive outpatient to just supportive services for people earlier in their addiction for opioids, alcohol, and a host of other comorbidities.
Now, addiction and mental health are certainly things that have been so much more highlighted during the pandemic because of the issues that have risen during that. But you have a really personal experience that led you here, and you started this company in 2015 and have a personal experience that goes a lot further back. Would you mind telling us a little bit about how you got to that point and what led to you co-founding this company?
Yeah, so I actually was lucky, I think, to have gotten sober very young and around 22 years of age. And that experience was phenomenal. And, it happened for me because I got access to all the right services, and I had genetic predisposition for addiction, but I got a great program. I was near an academic medical center. I got a good psychiatrist, and I got on a solid path towards recovery. And unfortunately, a lot of the people that were in my community at that time, flash forward, 10 years later, when I met Robin, were not sober anymore, and many of them had died. And so Robin and I met in the Bay Area. We were fast friends in recovery. We both had great careers in Silicon Valley, and we bonded early on about how odd it was that our day jobs were about building this on-demand healthcare and really predictive, tailored services, and that addiction care was still in the 1920s. But yeah, my own personal recovery very much informed building the company and this ethos of patient-led design. And, that patient voices were really missing from the design process for good evidence-based care. And that was a way that you build real world evidence and get it out into the hands of patients.
I think that's one of the things that I found most fascinating when you were initially telling us in the pre-interview about this company is that you and Robin, I believe you said, were helped by the traditional care that you said works for probably about 1% of the group. But you said that you've lost dozens of friends to ones who couldn't be helped by the system because it just wasn't the right fit for them for one reason or another. And so I love that while you had your own success, and it's kind of a tricky thing, there's probably a little bit of that hesitancy for so many people, like, okay, this worked for me, like I got it, I can't do anything to mess with this. But I love that you recognize that it worked for you, worked for Robin, but doesn't work for most people, and that you needed to find another way. And it's just an amazing mission. I love that.
Yeah, it was hard. Actually, we got a lot of pushback from recovery friends who were like, oh, you're leaving the pure path and looking at a different model. But we did it because people kept dying. And it was just like, obviously this isn't working for them. And we needed to look at a broader perspective. And I would say we were even anti-medication assisted treatment when we started the company. So it was quite an odyssey getting to the services that we have today, but I'm so grateful for the journey and grateful that we looked deeper and got the right scientists on board.
Amazing, Lisa. So what made you set out? I think you actually laid out for us really nicely when we were speaking earlier about what the challenges are with the traditional system. So could you lay that out for us as well? You were a recipient of that and it helped you, but then yet it doesn't help so many others. So what's missing?
Yeah, I think confidentiality and privacy are key. It's very difficult if you're an introvert, if you're a medical professional, if you're a teacher, to use traditional services that are very public facing and very exposing, even just in your community. As a case example, I once did an AA open talk, and a friend of mine came and who wasn't in recovery because it was an open meeting, but then her doctor was there, and she afterwards said to me, oh, I don't know if that should be my doctor anymore. And I felt terrible for having invited her to my open talk with that outcome. But there's real fear and there's real risks associated with people's participation in those groups. And so those are big barriers. I think cost is a big barrier, lack of ease of coverage. So really going on a wild goose chase to try to get your insurance to pay for care, forcing you to call 16 numbers when you don't feel like calling anyone. And then just the encumbrance of an all or nothing model that really forces you to jump immediately into total abstinence when you might be on 14 different substances, have a co-occurring depression or anxiety disorder, and that model is just never going to work for you because the bar is just going to be too steep. So those were all things that, in my own case, I had reached that moment where the costs were way higher of continuing and the benefits of quitting were there for me. But for a lot of people, it takes a lot more, and that formula doesn't happen for them sometimes ever throughout the whole life course.
Does it take those people to go through the traditional model before they find the Workit Health model? Or, how are you getting your message out there into the community so that they can understand that this is available to them?
Yeah, I mean, many of our patients have tried 2 to 3 other models before they come to us. I would say a good 30% are coming to us from having tried and failed at the traditional model. The others, I think, really are coming to us through new digital engagement strategies that we use. So part of what we do in our special sauce, really as patient-led design company, is that we go out and we do digital marketing on TikTok or Reddit or Facebook or places where we can just get out this message of low barrier, empowerment focus, meet you where you are, to people so they don't feel that same sense of impossibility about starting if they don't think that they can do the all or nothing way, and they understand that they can toe dip and they can start without being perfectly there. And that's really game changing for the field because you will see a lot more people try. If, for instance, they're an alcohol use disorder patient and they know that we have medications they can take while they continue to drink that are going to reduce their cravings and start to get them on a path towards recovery. That's never really been transparent information that people have known about broadly. And it's really exciting. It just broadens the tent for so many more individuals that never would have even tried. So oftentimes we get compared to traditional recovery services, and I really don't think that comparison makes a lot of sense. If you think about it like people like myself, the 1%, I think about the tip of the iceberg coming out of the water, right? Those people are in the traditional recovery circle, right? But then everyone under the water is not. And that's what Workit focuses on, the people under the water that are drowning basically, because they can't be on that one little tip or that island the way it's built.
You said that you have much better clinical outcomes than these traditional services. And you also said that the reason for that is because there's such a low barrier for entry, so that people just go on, give their insurance information, and then can get connected to a nurse practitioner or a doctor. And then from there, they end up with a care coach who can be a concierge for their experience throughout the portal and the platform, including helping them with local services. You said you try to match people within their local area, and sometimes not their local area if that's what they need to. And just having that ability to just get right in, because I loved that you were telling us before in the pre-interview that, addiction doesn't wait. This is a 24-hour cycle, and that's what you offer. But if you're having a breakdown on Friday at 10 p.m. and your next meeting's not until Thursday at 2 p.m., you really have a big gap. And so tell us why it was so important for you to fill that, and what kind of results you've been seeing from patients, just so much, I guess, more ready, or I guess more willing, catching them at that willing point to engage.
Yeah, I mean, I was sharing in the pre-interview the loss of my friend who passed away. And I actually have a trailing Facebook message from her from the period that she was in the ER waiting to get admitted before she left and overdosed. And that's that moment, right? Like, she was willing, she felt a lot of shame. She didn't want to re-engage with the recovery community because she was scared people would ostracize her, but she couldn't wait, the 6 hours in the ED to tell the story again, to go through the process again. And just never wanted those moments to occur for people ever again. And if you have a North Star like that, you can get pretty quickly to an onboarding that's human-centered and that's fast, not just because you got to get there through pre-contemplation, but because a lot of people are joining on Medicaid and they have a terrible cell phone, and you got to get them through to the appointment, and they got to get them to book the appointment. And those kinds of sensitive details make the difference between someone starting and not starting. And really looking at that hard and analytically, I think has made all the difference in the world.
Is the technology there to support all of this approach, the patient-centered approach, responsive and time-centered, is that available? And the other comment I have, based on what you were saying, is there a particular model that you're deploying that is based in some, psychology or behavioral health treatments that might be helpful for our audience to understand as well?
Sure. Yeah. In terms of technology, in terms of availability, yes, we have our own addiction EMR that's natively built that we use to support these flows. So people book within our own systems. They can see their treatment plan right away. They can do video visits with their practitioners right from the app. And so we're not navigating them to other services. We're keeping them right within Workit. In terms of the model that we're using, basically, the gold standard within addiction care is to provide medication-assisted treatment on the medication side of the medical team, and to provide the best evidence-based behavioral interventions, which are really cognitive behavioral therapy, gold standard at any addiction, regardless of whether it's a process use disorder or a substance. Extremely key tool to have in the toolkit. Additionally, for some substances, we're using contingency management for things like stimulants. So our core is to really have the best already determined evidence-based standards available through the app, and then just have the best trained recovery sensitive workforce in the country to deliver on that care and make sure that people get all the pieces. So they're not on a wait list for psychiatry, trying to see a counselor, but can't afford it because it's not covered by their plan. It just gives them the components that are key to success that have already been tested and proven. And we're really helping with the delivery and getting it into the hands of people.
Do you coordinate with their existing providers, sending information to their PCP or a therapist they may be working with? Or is that completely up to them, that you can coordinate if they want to, or keep it completely separate if they don't want you to?
Precisely. So for instance, we have people that private pay and they have coverage, but they just want to have this separate from the way that they engage with the health system otherwise. We certainly have disclosures and abilities for patients to consent to share with their practitioners, but we let the patient lead the way there. And then in terms of care coordination, we do a lot to actually refer members into primary care. I would say a good 60% of our patients at the gate are disconnected from primary care. We work with large Medicaid populations, so that's part of it. But even in the commercial population, people aren't taking the best care of themselves at the height of their addiction and haven't necessarily been doing routine medical checkups. Dental checkups is a big thing that falls off. And so we do a lot of referrals there to recovery sensitive folks. For instance, one of the big things that people share in the recovery community is like, oh, what dentist do you go to that doesn't give you meds? This sort of safe providers is something we're able to curate for our members because we have a strong social work workforce that establishes those lists of the appropriate contacts. But we know what to look for, which makes a big difference. So I think the referrals are key. We also have a lot of pregnant women in the platform that are scared of CPS, and they start with us, but then we can get them into a safe OBGYN setting that's friendly to concurrent addiction care and prenatal care, which is so important.
I love that you do offer that ability for people to remain as anonymous or as public as they want, and that your team is so prepared. And you said you train your professionals who work with you to really understand the nuances of, if somebody doesn't want a particular drug, don't try to push that agenda on them, really just let them help guide their experience.
Yeah, I think it's really fascinating. I guess, Steph, you had brought up the issue of outcomes earlier. And Lisa, when we were talking, you had mentioned that the outcomes here are so profound. So maybe you can talk through a little bit of what are those outcomes and how do they compare to traditional care models?
What you would expect to see, for instance, in our first program, the opioid use disorder program, is even in the best rapid access MAT clinics, you would expect to see, 40% engagement at month one, but then most people to drop off by month 6. And our larger health plan partners have echoed that, and their data shows that. What we tend to see is 86% retention at month 1 across now a 7,000 member cohort. And we do a real world evidence model, so we're reporting directly with our partners what's going on with their individual cohorts, but then retaining just 73% of those people at month 6 because of the low barrier to entry. That's just completely different, right? When I went to rehab, it was like 1 in 10 of you will be here tomorrow. It was very, very sad. It was like stage 4 cancer messaging. It's like, and 2/3 of those people will be gone a year from now. And it's just not encouraging when you have that kind of tough talk in the beginning to get that kind of message. And it's no wonder people are like, whoa, I got to get out of here. This is scary. So I think that's the difference maker. And I also think it's really the psychiatry piece that we do the integrated behavioral health care so people get stabilized enough to stay. And many programs don't do that or refer that out. And that's a big mistake in our view in terms of delivering the right kind of care in this space.
And that's a perfect segue to my final question, which is about what patients have said about their experience with you. Can you share a story that you might have about a patient who have said, just this changed my life. This made the difference for me. This is what I needed.
Yeah, so I was mentioning about finding testimonials in the wild, which is my favorite way to find testimonials. And, the team found one, it's posted on our Slack inspiration channel this week, of a patient who, some of the things they said, my NP, I was super impressed with, could tell she was actually engaged and cared. Told me they worked from a harm reduction approach, took into account everything I brought up, and was very intelligent. When we got on the subject of my dose, I told her that I had been taking what I had been taking for the last few months, and it seemed to be holding me, but I did have a few days where I'd get intense cravings. So she said, what I'm going to do is write your normal prescription with some extra strips. And those kinds of sensitivities, like tailoring actually the program to exactly the abstinence-based recovery goal that this patient had, is a game changer. It allows them to set their own pace to, not just take the standard protocol that most MDs would prescribe there, which would be to just, oh, you're having triggers, let's bump you up and send you on your way. Those kinds of tailoring stories really fill my heart, because it's how I know that someone feels seen and heard in a different way, and then they're gonna find themselves having a sense of belonging in their own recovery. That's really key to staying and getting out of their own social isolation.
This was amazing. Thank you so much for sharing your story. The story is of what your company is doing. And I mean, those outcomes, 86% within retention in month 1 is pretty amazing. So way to go. It's impressive. I'm so thankful you were here to share all of that with us.
Thanks for having me. It was a delight to talk to you both.
Thank you, Lisa. It was excellent.
And thank you all for watching. We'll talk to you soon. Bye-bye.